All right, we're going to be talking about psychological therapies. In psychotherapy, a trained therapist is going to use psychological techniques to assist someone seeking to overcome difficulties or achieve personal growth. The biomedical therapies are prescribed medications or medical procedures that act directly on the patient's nervous system. Half of all psychotherapists describe themselves as taking what we would call an eclectic approach, in which they use techniques from various forms of therapy, depending on the client's problem. Psychotherapy integration combines a selection of assorted techniques into a single coherent system. And as far as history of treatment goes, Philippe Pinel, we talked about him. He was the guy that drilled holes in people's skulls. And Dorothy Dix was one of the first people in the United States to help those who were mentally ill. And she tried to reform mental institutions and provide a place for people who were mentally ill to go. Psychoanalysis is Sigmund Freud's therapeutic approach of using the patient's free associations, resistances, dreams, and transference, and the therapist's interpretations of them to help this person release repressed feelings and gain self-insight. The goal of psychoanalysis is to help people gain insight into the unconscious origins of their disorders, to work through those accompanying feelings, and to take responsibility for their own growth. Psychoanalysts draw on techniques such as free association, which is saying aloud anything that comes to your mind, resistances, which is the defensive blocking from awareness of anxiety-laden material, and their interpretation, and other behaviors such as transference, which is transferring to the therapist of long repressed feelings. Freud also believed that latent content of dreams was another clue to unconscious conflicts. Like the psychoanalytic perspective on personality, psychoanalysis is criticized because its interpretations are hard to prove and disprove, and is time-consuming and very costly. Influenced by Freud, psychodynamic therapists try to understand patients' current symptoms by exploring their childhood experiences and the therapist-patient relationship. They may also help the person explore and gain perspective on defended against thoughts and feelings. However, they talk with the patient face-to-face once a week and only for a few weeks or months. Interpersonal psychotherapy is a brief variation of psychodynamic therapy, and it emphasizes symptom relief in the present, not overall personality change. The therapist also focuses on current relationships and the mastery of relationship skills, and it's been effective with depressed patients.